So I told you before the show started, I want to have some guests in studio. We have Dr. Bartlett here again today, and he is joined by two different people who will be talking with you very directly about their family's experience, their personal health experience with COVID-19 in Texas. And I don't really know their stories, so I'm going to turn to Dr. Bartlett and allow him to introduce them and tell you all about them. So first, welcome to the show, Dr. Bartlett.
Thank you, Debbie. It's my pleasure to have a friend and colleague, Jerry Lyon, a nurse practitioner here in Texas, here with us to tell his story. We've worked together side by side for patients for years. He has excellent skills and judgment. And he moved to Fort Worth, and his wife became ill with COVID, and she's in the Baylor hospital now with COVID. And so he reached out to me to ask about inhaled budesonide, and we talked about it colleague to colleague. And apparently, we were thrilled this morning with a good report from you, and then things have turned. Can you explain what's happened?
Well, first of all, she's also fighting squamous cell carcinoma, stage 4.
Yes, sir.
And she's had 3 strokes back to back, and then she got COVID, pneumonia, and I had talked to you about the budesonide because I'd heard your presentation before, and I have so much faith in everything that you've studied and researched. And so I got her to ask her nurse to ask her doctor if they would give her the budesonide. And it was my understanding she got 2 treatments. And before that, she could just barely whisper. She had 30% oxygen output. She's on high flow oxygen. She's practically dead. And
were they considering intubating her? Did they mention that to you?
No, they didn't. And I was, if she needed it, yes, but I'm glad they didn't have to.
Yes.
So all of a sudden she got better. She could actually talk, and I could understand what she was saying. And then the very next day she was back to a whisper. She said they stopped the treatments, and I did talk to her doctor, and she said that she didn't know what happened, that the treatments got stopped, but that she had put the order back in to start the treatments. Then she called me back and said, we can't do that because they said that nebulized treatment releases the virus into the air. And I said, well, if it gets it out of the body, doesn't that cure the person? Well, no, it makes everybody else sick. And I said, ma'am, you're not making any sense. And so they decided they would give her a puffer. And I said, it's not going to work. It's not going to work. And so that's where we are now.
Jerry, I'm going to give you a copy of my paper because there's 51 articles that we cite, references that show that this has already been addressed, that in nebulized budesonide does not increase the risk. Nebulized medicines do not increase the risk of spreading the disease. That's already been studied, it's already been proven. And it's also been proven that using an inhaler, it does not deliver 90% of the medicine, only 10% of the medicine gets where you need it. So what you're saying is correct. Your understanding is correct. So I'll give you that paper and you'll be armed with that to help people understand what to do for your wife, who is still fighting for her life with COVID. And we're pulling for her.
Well, she'll get better.
Yes.
And I want to make sure that her doctor listens and reads your paper.
But she did improve for a while at Baylor
with
the
I was so
nebulized
excited.
budesonide. I was so thrilled this morning with that report. So it is not over, sir.
No.
I do want to jump in with one question because I mentioned before we came on today about that one question. That is one question people had raised with respect to your prescription about the nebulizer, using budesonide via the nebulizer, was that somehow it's dispersed in the air. And there's a word, aereo something, but
Aerosolized
Yes,
is the term. And so that's the concern, but it wasn't real. It actually was studied by other people and already proved to not be an issue. Actually, it's been disproved. It's kind of like COVID causes an overreaction of the body, the overreaction of the immune system, and that's the killer. What we're seeing in the state of Texas is kind of an overreaction to COVID, as you pointed out in the first 5 minutes, that we're doing things that we've never done before for the flu, which has killed 3 times as many people in a year historically. And we've never said wear masks and stay 6 feet apart from each other and other things. And so it's kind of an overreaction. And so this concern, I mean, you can say there's a fear of this and a fear of that, but when it's unfounded, when it's disproved, you have to go with science and evidence-based medicine. There is still a place for science in medicine.
let's hope a big place for science in medicine. Yes, big place for science it is. So I had meant to ask you that yesterday and want to clarify that, because I think it is one of the things when people are finding reasons this couldn't be true, that was one of them, and so I'm glad to know it's been addressed and it's not true.
And you have a copy of my paper that you can send to the 3 million plus viewers that are asking for it.
You can get it on our website. Go to our website, AmericanWeTalk.org, on the homepage, under blogs, there is the paper. Yes, I've been sending it out to people who've been asking, but it's much easier if you locate it on our website. And we have been sending out to, I can't tell you, literally countries all over the world. I was thinking, I wish I started to make a list, but doctors in the Netherlands, in New Zealand, all over the world saying, I really want to see that paper. So it is just, it's changing the way medical thought thinks about COVID.
It's reversing it back to normal common sense thinking of early treatment. We do that with heart disease, stroke, cancer, every other kind of infection. Early intervention saves lives. And millions of Americans are alive today because of that strategy.
Yep.
But we haven't used that strategy with one disease, COVID. And the strategy right now of late care is failing.
Absolutely. Jerry Lyon, thank you for coming on, sharing your story today, and just prayers for your wife's complete
Absolutely.
Healing. And
Thank you.
And thank you for sharing your story. It's very
Yes, sir.
tender. Thank you.
Yeah.
Yes, sir.
Thank you for having me.
Yes, sir.
While we're switching out guests, I'm going to tell you we're going to switch out guests here. So glad Jerry Lyon could join us, and we're going to have joining us next a gentleman named Francisco Bejarano, and he is here from, I think, the Midland area, and don't know much about his story, except he's also has gone through COVID-19. I do know that I received a video, and I actually never asked Matt the Wonderful. I sent the video to Matt. Are we able to play that little video? Okay, so I will play this, a very short video, just to get a contrast for how this healthy patient sitting here today looks and sounds compared with how he felt just a few short weeks ago.
11 days straight, I can't breathe. I feel like there's something really heavy on top of my chest. I don't feel confident going to the ER. I feel like if I go to the ER, I'm going to catch some kind of a bigger strand or some type of other COVID that's really going to do me in. I'm very afraid to go to the ER.
That, my friends, is Francisco, and I'm glad we could play that video of him. And actually, one of the things I'll say, an introductory point to our interview, is that there are, because of the shutdown provisions in Texas, including telling people that they could not go to the hospital unless they had an extreme emergency. We've had cases, we've had doctors talking about in the show, of cases where people were a little bit afraid to go to the ER, afraid of catching COVID, and stayed home longer than they should have, experiencing very serious symptoms of heart attacks. But we got so frozen in place, or we're dealing with COVID-19, that we actually lost people due to problems that may have been prevented or solved at the emergency rooms. Thank you for coming all the way into our studio today. Welcome.
Thank you. Thank you for having me.
And I just want to have Dr. Bartlett, this is your patient. I'm going to let you tell your story, because I don't know all that happened.
Francisco, his friends, we call him JB, reached out to me for the first time over the phone because a mutual friend said, would you please help my friend? And so he had tracked me down through a friend and sent me that video and texted me desperate for help. He had been sick for
Oh,
11
he sent
days.
that video to you. Okay.
Yeah.
Okay.
And Francisco had been treated with several other medicines. We know that there is no FDA-approved medication yet for COVID. That being said, what is being done right now is leaving a trail of death, a trail of tears, and heartache without treatment. And so there are good doctors, thousands across Texas, that are stepping up and treating their patients with things that are tried and true evidence-based medicine. But when he reached out to me, he said, "My lips are purple, I'm short of breath, I can't breathe, I feel like an elephant on my chest, would you please help me?" And so we started the journey together, and I'm going to let Francisco, I'm going to let you take it from the start so people understand what COVID is and your experience.
Well, Dr. Bartlett, first of all, thank you very much. Thank you for helping me and my family. My wife was sick on a Thursday, and she went to go get tested with a local physician there in the Midland, Odessa area. Over the weekend, I started to develop symptoms as far as coughing, a little bit of fever, the typical COVID symptoms, whatnot. And Monday, she got her results back. And after she got her results back and she tested positive, I went to the doctor because I was feeling sick. So after going to the doctor initially, he gave me a prescription. He gave me
you said azithromycin, a Z-Pack.
Yes, gave me a Z-Pack, some cough medicine, and that was basically it. Told me to go home, tough it out, do some quarantine, and just basically just stay at home. So I took the prescription as the doctor said and as needed. 5 days went by. I didn't feel any better. I wasn't feeling like I was breathing. So I went back to my doctor and I asked him, "Is there anything else that I can take?" And he basically gave me an inhaler, and
that was albuterol.
Albuterol, correct. And he gave me another prescription, which was doxycycline.
Yes.
And took that for another 5 days, and that didn't work either. So I started to kind of panic, and unfortunately, I had a friend of mine that his brother passed, Patrick Rodriguez. And my buddy Jamie called me and he said, "Hey, my brother passed, take care of yourself, do something." That night, I panicked. I couldn't sleep. My wife was worried about me. I had that my son went out and bought me a little oxygen meter.
A pulse oximeter.
Yes, sir. And my oxygen was from 86 to 89 as far as oxygen wise, and I wasn't getting very much oxygen. So that night, like I said, I couldn't sleep. I actually was laying in bed, no joke. Here I am, a little West Texas contractor. I own a little roofing commercial company in West Texas. And I'm sitting there writing my will, telling my wife who I have my insurance with if something was to happen, telling my wife what my equipment is worth, in case I did pass. I wanted her to have all this information. Well, unfortunately, with the passing of my friend's brother, I got up, did a Facebook plea. Does anybody know Dr. Richard Bartlett? And I had a friend of mine, Shannon Gaylor. He goes, "Yeah, I know him." He goes, "Let me call him." It's like ordering a pizza, I guess. And 2 minutes later, Dr. Bartlett calls me and he goes, "Hey, JB, what's going on?" "Doc, I can't breathe. I feel like there's an elephant on my chest." He wrote me a prescription. Within 2 hours, I started doing the budesonide treatment with the nebulizer.
At home?
At home with my family. My wife, of course, had the virus. My 2 other kids had the virus. And I'm at home with the nebulizer taking double the dosage. And that night, after doing probably 5 treatments within every 2 hours, that night, he was texted, Dr. Bartlett was texting me. He was checking up on me. Hey, how are you? How are you feeling? I kid you not, that night was the first great rest that I had in a long time, because I knew that I was turning around symptom-wise. I knew that I was going to get better. I knew that I didn't have to worry about my family. I knew that I was going to pull through, and that I was actually going to make it. The first sense of relief without having the anxiety. If I was going to wake up at night, if I was going to wake up the next day, afraid to go to sleep because I was afraid that I was going to pass. The second day, I just felt better. Of course, taking the medication, I felt better. The third day, I felt great, and I just started to improve. Finally, by the 7th day, I did 1 treatment in the morning, and I did 1 treatment at night. On my 8th day, I felt absolutely great, felt fabulous. The 9th day, I felt great. On the 10th day, I made an appointment to get tested, just to see if I was really over it. And thank God.
Too good to be true. Yeah.
Too good to be true. Well, guess what? I went. I did a test, and I came out negative. And I was so blessed to get over COVID. But I'll tell you another thing too, is that I'm also blessed that it happened to me, because I'm happy that it did happen to me, because now I'm able to do better, healthier choices, to eat better, to diet better, to enjoy more time with my family, and not take some of the things that I used to take for granted. So I kind of have a different outlook in life, so I'm not happy that it happened to me, but I'm glad that it happened to me. And through all this and the great network of people that I've gotten to meet, I've been able to help other people, like, hey, JB, what did you take? What did Dr. Bartlett give you? Well, you know what? Here's a screenshot of everything that I take. Here you go. I hope that your doctor gives it to you.
I want to thank JB for, on his own dime, being willing to drive 6 hours here and take time away from his business that he's running as a small business owner, to get the word out that there is hope, and that there are several options available as far as treatment options, and this is one that worked for him. And so he's trying to tell the people that there's good news.
It is a tremendous story, and I'm so glad you could share it. And I think there's so many people that it helps to have a real person sitting there telling their story versus a doctor, credible, wonderful doctors, but still a doctor saying, don't worry, it works, but a real person saying, I went through this. So roughly in the time period, you were ill for, if I was doing it, like 10 days before you got to Dr. Bartlett. Is that correct?
That's absolutely correct. Okay. I was in bed hoping and praying that I would get better, and that didn't happen. And unfortunately, the passing of a friend of mine was my 911, I guess, to get out of bed. JB, you just can't lay here. You have to do something. You have to figure something out. What's my wife gonna do? What's my daughter gonna do? She's barely 12. I'm self-employed. I own, a small little roofing company. What's my wife gonna do? Who's she gonna depend on? Nobody. I'm it. I'm the captain of the Bejarano family ship. I'm the owner of Texas Roof Systems, and nobody else is going to be able to see this through except me. JB, you got to get up and do something for yourself. You got to get up and fight and be better. There's somebody out there that can help you, and it's this great man that helped me through it. I can't be so thankful and express my gratitude of how I am of Dr. Bartlett. When he asked me, he goes, hey, would you be willing to come to Dallas and do an interview? I'm like, yes, absolutely. Hell yes. I'll drive over there and come and do the interview. No ands, if, or buts. I canceled my whole day to come out here and try to help people out and spread the, help with some of the treatment that's out there. There's a lot of doctors, maybe, I don't know what it is. I don't know why these people just can't give people a chance to take some budesonide, I guess. I mean, if I'm right or wrong, don't they give it to babies?
They give it down to 2-pound premature babies in the ICU, and they use it on elderly, fragile people in nursing homes. It's been out for over 20 years. It's been proven to be very safe. It's generic. No one's going to make any money off of it. Big Pharma's not going to make any money off of it. There's not a lot of downside to it.
That was another point I meant to hit in yesterday's interview, was that for people advocating for the use of any of these steroids, including budesonide with a nebulizer to help with COVID, you're not financially invested in this outcome.
No.
I mean, the patents are long past. They are relatively inexpensive, and yet they're working. But one of the things you said, I want to go back, JB, and said, this is not that common, at least in my experience, that you were able to track down Dr. Bartlett, call him, or whatever you did, send your video to him, but he was checking back up with you. How you doing? I mean, I think of that in the hospital. That happens. The doctor makes his rounds. Hey, hi. But this kind of, caring, reaching back out to you who were not. I mean, you just met him through this experience. That's not that common for doctors to do.
It isn't very common, and thankfully, in the Midland, Odessa area, I have a lot of friends. I know a lot of business people. When I made my Facebook plea, I guess, if you want to call it that, does anybody know Dr. Richard Bartlett? My great friend, Shannon Gaylor, he said, yeah, I know him. Gentleman called me back, Dr. Bartlett called me back in 2 minutes. Who does that? I don't know if it's a West Texas thing, a good old boy thing, or what it is, or the duality of man.
A good doctor thing.
Yeah, absolutely a good doctor thing. Never, I mean, Dr. Bartlett called me, what do you need? There it was. I had it in my possession within a couple of hours. The man's checking up on me at 12:30 at night. He's calling me, making sure how am I breathing, how my oxygen level is. I mean, the man was relentless, nonstop, checking up on my well-being.
And you can check your oxygen level with something you had at home.
Yes.
You purchased. Okay.
My son, he went out and bought a little oxygen meter.
Okay, I didn't know there were such things. Okay.
It's called a pulse oximeter, and it checks your oxygen saturation. And 96 to 98 is normal for an adult that has no health problems. And so he's a healthy, athletic guy. It should have been 96 to 98. When it gets to below 90, as an ER doctor in the emergency room, I was just in the ER this weekend, if someone's under 90 and they have no pre-existing condition, we refer them to be admitted to the hospital.
It's an alarming signal.
Yes.
Yeah. And you were 86, you said?
Yes, ma'am.
Yeah.
86 to 92 was kind of what I was fluctuating in.
Okay. So, Dr. Bartlett, this is a great story. I'm glad, a personal story. I love hearing all of it. So, you've had other experiences like this where it's not just your existing practice and people coming in, or your emergency room, but people referring you. Has this happened a bunch of times, people just calling you because you've gotten this story going? I'm assuming it has.
My phone is ringing off the hook. But I started my practice in a small town as the only doctor in the community. And so whatever came in, I was it. If it was a heart attack, I was it. If it was a car wreck, I was it. I had to take care of several people that were hit on the side of the road before anyone could get there. And so this is why I got into medicine. There are a lot of doctors that got into medicine to help people. And there's good people. I got relatives that gave their lives in Korea and other countries to help other Americans that they don't even know. But yeah. I have the privilege of helping people that I get to meet and to care about them. And there's a lot of doctors that still care about their patients.
I was going to say that on this ongoing national political conversation surrounding COVID-19 and coronavirus and treatments and vaccines, it does seem like the stories like yours and Congressman Abraham, who was here yesterday, real people treating real patients, that's what the practice of medicine is supposed to be all about, is just you deal with someone, whatever their challenge is, their health issue is, and you use not necessarily what everyone in the medical world is telling you, but you use your education, your knowledge, your assessment of the person you're looking at, and provide a treatment. And the kind of, it is the reason I like to think still most doctors go into practice of medicine. It's not to become wealthy and famous. It's because you love your fellow man and you want to find ways to help them.
And there's many doctors that are more important than me, and they'll tell you they're more important to me. But the patients are what's important. And there's like a consciousness of humanity happening right now, partly through your show, that if I get COVID, I don't necessarily have to be on a ventilator. If to survive this pandemic, you know what? I may not need a vaccine. Maybe I don't have to suffer needlessly for weeks, hoping that I'm not going to die. Maybe, are you telling me that possibly for $3, I could get relief from my shortness of breath and chest pain in the comfort of my home watching Netflix? Mm-hmm. That's $3 is the price of a cup of coffee at Starbucks. And so that's the cost of one of the treatments, the breathing treatments. They're generic, they're cheap.
And everything you're talking about, it must be prescribed. You can't buy this over the counter.
Yes, that's right. So budesonide is a prescription medicine. And so if you have COVID, ask your doctor if inhaled budesonide with a nebulizer machine is right for you.
I can't imagine why they'd say no, unless you have some other health conditions that change that. But I can't thank you enough for coming in. I really hope this helps people. I think it's people like in our culture especially like to turn to experts, like to believe they're experts. And if the experts are whoever you think the experts are, and they greeted this unfortunate infliction on America of the coronavirus with fear. Everyone felt fear. They greeted with fear, and then they wanted answers, and the first answers coming out were kind of a, huddle in place and stay home. And then ultimately, very quickly, many of the pharmaceutical companies came up with the idea we can find a vaccine for this. And you can't blame Americans for getting on board with, oh, good, okay, this is how we'll solve it. But here we are, mid-July. This has been around since whatever we're counting, at least January. Now it appears actually during 2019 it was even here. But we have these other solutions, and I think there's just, it's an astonishing observation how you have to kind of chip away a little bit at the assumption people have that the experts know the answer, and until I hear it from, some whoever it's going to be, I'm always blaming Dr. Fauci because I've not liked his attitude very much, but Fauci or whoever it is, they start America down a path, and it's astonishing how hard it seems to be to kind of root people off that path. But when you hear stories like this, and you look right in your face, an innocent guy who's, went through a terrible struggle and found relief through Dr. Bartlett's procedure, I hope that works to just chip away at the expectation, only the experts can help me.
Be afraid, be very afraid. Be suspicious of your neighbor. Stay away from everyone, including your loved ones. If you get put in the hospital, you can't be around your loved ones.
And it's all over. Yeah.
The separation, all these things have been the strategy in the beginning, but thank God we have a solution now, and we don't have to hold our breath and be in fear. And I'm not afraid of COVID anymore, and neither should you be. Neither should your viewers.
Dr. Bartlett, that's so well said. Thank you so much. Anything else before you wanted to add? Thank you for sharing your story. Anything you want to add, you're more than welcome.
I just want to say, don't take your life for granted. Cherish every moment. Get a little bit closer to your kids, your wife. Worry about what's inside your four walls necessarily, which is your family. Try to do a good deed a day, and that's pretty much it. And
I know that there's
be a good steward of God.
Yeah. I know that there's an answer for COVID-19.
This is literally an answer to prayer.
Yes,
yeah.
yes.
This is an answer to prayer, and I would like to dedicate this show to the Rodriguez family that lost their loved one, our friend.
Absolutely.
Yep. This was the one whose brother was also potentially going to come in. Well, there's another person that both you gentlemen know who, a young man, I think 31 years old, lost his life, but one of his Brothers has put a video. In fact, it's up on our Facebook page at America Can We Talk. His video where he tells his story of losing his brother and then realizing he had similar symptoms and deciding he was going to try to reach out and did successfully reach out to Dr. Richard Bartlett. Now he's all better too. And so they're great stories. These are human stories, and they may be, as many people will say, well, they're usually just anecdotal, but the fact is they're real life. They're real life doctors doing real patients. So thank you again for coming in so very much.
Thank you for having me.
Anything else you want to add, Dr. Bartlett? It's great to have you 2 days in a row.
I'm not afraid of COVID anymore, and no one else needs to be either.
Well, I don't want to be afraid of it either.